Ever wondered what steps are involved in treating the more severe stages of hypertension? Well, today we'll delve into the world of hypertension and its stages, specifically stages 3 and 4. Hypertension, also known as high blood pressure, is a serious condition that can lead to severe health complications if not managed properly. The treatment for hypertension is often a step-by-step process, and today we'll focus on steps 3 and 4. In stage 3 hypertension, the treatment usually involves the addition of a third drug to the patient's regimen. If the patient is already taking a combination of drugs A and C, for instance, then we add drug D. Similarly, if the patient is on a cocktail of drugs A and D, then drug C is added, therefore the patient ends up on a combination of drugs A, C, and D. Now moving on to stage 4 hypertension. This stage is often referred to as resistant hypertension. The treatment for this stage involves either adding a fourth drug or seeking specialist advice. But before proceeding with either of these steps, there are some vital checks that need to be done. First, confirm if the clinic blood pressure is elevated using ambulatory blood pressure monitoring or home blood pressure monitoring. Secondly, assess for postural hypotension, a condition where a person's blood pressure drops suddenly when they stand up from a lying position. Lastly, discuss adherence to the medication regimen with the patient, as this is crucial for effective treatment. If the patient's potassium level is less than 4.5 millimoles per liter, add a low dose of spironolactone. However, if the potassium level is more than 4.5 millimoles per liter, then add an alpha or beta blocker. Patients who fail to respond to these measures should be referred to a specialist. The National Institute for Health and Care Excellence, or NICE, recommends seeking expert advice if the patient's blood pressure remains uncontrolled, even with the optimal or maximum tolerated doses of 4 drugs. To sum up, the treatment of stage 3 hypertension involves adding a third drug to the patient's regimen depending on the combination of drugs they are already on. Stage 4 hypertension treatment involves either adding a fourth drug or seeking specialist advice after conducting necessary checks and discussions with the patient. If the patient's blood pressure remains uncontrolled despite these measures, it is recommended to seek expert advice. Remember, managing hypertension effectively is key to preventing severe health complications. Understanding the treatment steps is the first step towards effective management. And that's what we've explored today, the treatment steps for hypertension stages 3 and 4.